Wow, we've made it to the RNA negatives. And interestingly, I'm currently sick with an RNA negative infection. No joke. So I apologize for my voice. Anyway, with this video, we're going to dive right into one of the most important RNA negatives we'll cover, the orthomyxovirus family, which causes influenza. So we set the scene for orthomyxovirus at an orthodontist's office. Sorry for all you budding orthopedists out there that we went in this direction instead, but the sketch will be called Night Shift at the Orthodontist's. So as we're drawing the office, let me lay out some ground rules for the RNA negatives. First, since it's an RNA virus, we'll continue to use warm hues of yellow or orange, as you can see on our walls. However, now that we're talking about RNA negatives, we're going to change up from a daytime scene to a nighttime scene. And all the RNA negatives will have this moon here. And we've put this cloud in front of each moon that looks somewhat like a negative sign. Subliminal messaging. Well, I guess it's not subliminal anymore since I just told you, so I guess that just makes it regular liminal messaging. Okay, another thing about RNA negatives. Remember how positive sense RNA viruses were sneaky and could use the host cell RNA polymerase? Well, this was because positive sense RNA can directly be translated to proteins, which is how host cell RNA is. Negatives need to be transcribed into a positive strand, so in order to do this, all negatives must bring their own RNA polymerase. We're not going to illustrate this since all RNA negatives bring along their own polymerase, so write this down in your noggin. RNA negatives bring along their own RNA polymerases. Also, RNA negatives are all single-stranded. The only double-stranded RNA virus we're covering is reovirus. So when you hear RNA, default to thinking it's single-stranded unless it's reovirus, the only exception. We're not going to illustrate single-stranded, we're only going to illustrate the double-stranded one, which is reovirus. And finally, all RNA viruses replicate in the cytoplasm. 100%. No exceptions.
Orthomyxovirus
Wait,
does.
what? What's that? Hold on, sorry.
Yeah, bro. Orthomyxovirus does.
Shit, you sure?
Yeah, man.
Okay, apparently there's an exception, and that's this virus, orthomyxovirus, the only RNA virus that replicates in the nucleus. So other than orthomyxovirus, all RNA viruses replicate in the cytoplasm. And we're not going to illustrate this, only the exception, which is orthomyxovirus, and you'll see that in just a bit. So one last time, RNA negatives will have a warm color scheme to represent RNA. They'll take place at night to represent that it's a negative sense, and all RNA negatives must bring along their own RNA polymerase, and they're all single-stranded, reovirus being the exception. Finally, almost all RNA viruses, except for orthomyxovirus, replicates in the cytoplasm. So now let's get into more specifics about orthomyxovirus. So first, do you think orthomyxovirus is naked or enveloped? I'll give you a hint. The answer is already drawn in the drawing. And I don't see a big naked David statue, so that's out. So if it's not naked, it's enveloped, which is represented by the orthodontist who is wearing a nice long white coat. We've barely drawn anything, and you already know a lot of the general characteristics of orthomyxovirus. It's pretty crazy to think about how efficiently your brain space is being used. So effortless, and yet you're already almost a micro-genius. Alright, let's keep going. Orthomyxovirus family has several different viruses within it, but most importantly, it includes the influenza virus, which will be the primary focus of the video. To remind you of this, we have a bottle of fluoride on the poster hanging on the wall. And there are 3 types of influenza, strains A, B, and C. So as you can see on the poster, it says as easy as ABC. So to describe some of the key features of this virus, let's take a look at the aquarium that you often find in the waiting room of an orthodontist's office. And now take a look at the star of the show, this octopus. Next to her, she has her octopus babies floating around inside the helmet. Why inside the helmet? This is to remind you that orthomyxovirus is not like other RNA viruses, which typically replicate in the cytoplasm. So as I've said, this is the exception to the rule. Orthomyxoviruses replicate within the nucleus. Thus we have Mama Octopus and her little replicas swimming around inside the nucleus-like diver's helmet. So why did we choose an octopus to be the star of the aquarium? Because they're awesome. But Really, it's because of those 8 arms. The arms represent the 8 segments of orthomyxovirus. Orthomyxovirus is one of 4 viruses that are segmented. The others are bunyovirus, arenavirus, and reovirus. And altogether, they form the mnemonic BOAR, B-O-A-R, which we'll refer to repeatedly in our videos. And why is it important to know if it's segmented? Well, it relates to how the orthomyxovirus family can mutate. There are 2 broad categories of mutations known as antigenic shift and antigenic drift. This is an important concept to understand for your exams, and you must be able to distinguish between the 2. So to explain this, let's go back to this board in the back of the room. Antigenic drift is when you have point mutations in the viral genome leading to changes in the hemagglutinin or neuroimmunidase molecules, which are abbreviated HA or NA. And we'll explain more about those later. But to illustrate drift as a point mutation, we're going to write up Dr. Drift on the board. Notice how there's 1 letter changed to symbolize a single point mutation. The C is misplaced with a K. As a result, the virus is slightly altered. It's the reason why every year we need a new flu shot and is associated with epidemics, meaning disease outbreaks limited to one particular geographic area. On the other hand, antigenic shifts are much more serious. Shifts occur when antigenic segments of RNA are shared between different species. Specifically, the H's and the N's can combine and form a new virus that is a mixture of the surface antigens. To illustrate this, we have the name of the office, the night shift, and see how this H is falling off or is falling down to the bottom of the sign? That represents a potential new species for mixing. These types of mutations are responsible for pandemics, which are outbreaks of a disease that occur over multiple continents or worldwide. So note that this is only possible because orthomyxovirus is segmented. So to recap, antigenic drifts are point mutations that cause epidemics, and an example is the seasonal flu, while antigenic shifts are a result of segment reassortment that cause pandemics. All of this is a type of antigenic variation, which is reminiscent of some of our other videos, like rhinovirus. So that's why we're going to draw on these multicolored curtains to remind you of that. The most recent flu pandemic was the H1N1 outbreak in 2009, and if you recall, this was called swine flu because the virus was a result of antigenic shift between human, avian, and swine influenza viruses. Now, I said earlier that there are 3 main influenza viruses, A, B, and C. For your exams, remember that influenza A is the most important of the 3, as it's the cause of epidemics and pandemics, while influenza B typically causes endemic outbreaks. So to simplify things, associate influenza A with both antigenic drift and shift, while influenza B is usually associated with just antigenic drift. Now let's move on to the rocks that our octopus is sitting on. What do they look like? Hopefully you can see that we've drawn them to look like a bunch of red blood cells. And they're getting stuck together by his suckers, which will be our symbol for hemagglutinin, or HA. To help you remember HA, we'll even call the aquarium Heme Aquarium. HA is a glycoprotein on the surface of influenza viruses, which binds to sialic acid found on membranes on cells in the upper respiratory tract or on red blood cells. It's called hemagglutinin because it causes red blood cells to clump together in test tubes, just like they are in our tank. The plants along the rocks are supposed to look like the carbohydrate chains of sialic acid, so imagine these residues sticking out from the surface of the red cells. There are many different HA antigens, but H1, H2, and H3 are the ones that are seen in influenza viruses that infect humans. To remind you of this variety, the octopus has multicolored suckers. That's why certain strains of the flu infect only humans, and it essentially determines which cells the virus can bind to, which is the initial step of viral infection. This means that it defines the tropism, or cells that can be infected by the virus. Additionally, the anti-HA antibodies that you make are what protect you from an infection with the same strain in the future. So now that we've gone over general characteristics, let's talk about the process of viral infection. The HA molecule in the virus binds to sialic acid on the cell membrane. The virus is then endocytosed into the cell. Now, in order to proceed with the next step, which is viral encoding, the pH needs to be just right. This is accomplished by the M2 protein, which is a proton channel. And our symbol for this protein is going to be this shell. Notice how the shell's ridges look like M's? And there are two M's to remind you of M2 protein. Remember, this M2 protein is needed to create the proper pH for viral encoding. Theoretically, if we can prevent viral encoding by inhibiting M2, we can prevent viral replication. And that's what drugs like amantadine and rimantadine do. They inhibit M2 protein. So to remind you of this, we're going to draw in this manta ray that is ready to dine on the octopus. The manta ready to dine, or mantadine, should remind you of a mantadine, or rimantadine. So in the presence of the manta, the octopus, representing influenza, remains hidden inside the shell and won't leave, which should remind you that amantadine inhibits viral encoding. Amantadine and rimantadine are fairly old treatments, and they're no longer recommended for treatment of influenza infections because of the high level of resistance that exists in current viral strains. Also, they only work against influenza A because influenza B lacks an M2 protein. However, amantadine has a use outside of infectious disease. It's used to help treat Parkinson's disease, to increase dopamine release in the CNS through an unknown mechanism. So, as we know, the virus will replicate inside the cell, specifically in the nucleus, but now it needs to get all the virus babies out into the world to infect other cells. But there's a catch. These viruses become bound to the host cell after replication through the same sialic acid residues that HA was initially bound to. And that's where the other major virulence factor comes in, and it's called neuraminidase, or Na for short. So look here, we've got this diver's helmet filled with little baby octopi, and the mother octopus has taken a scalpel from the dental tray to break her babies free from the sialic acid. To break her babies free from the sialic acid aquarium plants that are holding them inside. And this is what neuraminidase does. It cleaves the sialic acid to release the newly formed virions from the host cell. To remember the word neuraminidase, you'll note the scalpel is missing from the nurse assistant's tray, Na for nurse assistant. Our lovely nurse assistant's name is Tammy V. Ever heard of Tamiflu? It's the trade name for oseltamivir, which is a neuraminidase inhibitor, yet another target of anti-influenza drugs, along with anamivir. Tammy V is supposed to remind you of 1. Tamiflu, and 2. Tamivir, the common ending to these drugs. How do these drugs work? Well, they prevent the release of the little replicas. In other words, they ensure the scalpel cannot work. So you can see that Tammy V is capping all of the scalpels to the right, making sure that they can't do their job. Giving Tamiflu after a 72-hour period will not be effective to someone with the flu because the virions have already been replicated and released by then. It must be given early in the course. So now let's talk about influenza in clinical practice. It's spread via respiratory droplets, as demonstrated by these little droplets coming off of the aquarium. And the flu season in the United States is typically from December to February. The reason I mention this is the question stem will oftentimes include the month, and that should point you in the direction towards influenza, if it's around December through February. Also, given a particular month, you should know when would be an appropriate time to give the patient the influenza vaccine. Typically, this occurs around October, so that people can build an adequate immune response prior to exposure to the virus. There are 2 vaccines available, a live attenuated nasal spray, and a killed form that's injectable. To remind you of these 2 types, the pirate skeleton, which represents killed, is being impaled by what looks like a syringe, so you know the IM is the killed version. And these bubblers here are going up through the nose to remind you of the intranasal vaccine, which is live attenuated. The killed vaccine comes in 2 forms, a trivalent vaccine made from 2 A strains and 1 B strain, or the quadrivalent vaccine with 2 strains of A and 2 of B. Also, starting after the age of 6 months, children can receive this vaccine. A typical influenza board question will give you the case of an old person who has a history that is obviously the flu. Imagine this patient in your head. She's a 72-year-old woman with myalgias, fever, maybe a non-productive cough for about 7 days, and the story goes that she seemed to get a little bit better, and then after that, she started to have a productive cough and fever, and when she finally comes into your office, she's looking really sick. And what I've just described to you is a major complication of influenza. It's pneumonia. So notice we're drawing lungs on this kid's bib to remind you that pneumonia is a common complication of influenza. So pneumonia caused by what? Staph aureus is a common culprit of bacterial superinfection, but remember that other common causes of pneumonia, like strep pneumo, can also be responsible. So to remind you to think of Staph aureus, we've got the orthodontist inspecting the child's mouth with a golden staff that looks just like the one we used in our Staph aureus video. Another board favorite is the story of a child who gets the flu, and his mother, trying to make him feel better, gives him aspirin. And look here, we've got this nice bottle of children's aspirin. In reality, this is a big mistake. Aspirin is a big no-no when it comes to kids with flu, which is why we've drawn a little skull and crossbones on the bottle. That's because they have the risk of developing Reye's syndrome, which is a life-threatening complication that typically involves liver failure and encephalitis. So we've got a cow with a liver spot that is super fat to remind you of fatty liver and liver failure. There's also a man with a turban on the bottle to remind you of encephalitis. The child may also have symptoms such as a fever, symbolized by the sun, rash, and vomiting. If there's one thing you can remember about this aspirin bottle, remember the sun and its giant rays for Reye's syndrome. However, what really seals the deal is a history of recent aspirin use. Aspirin has another effect, which is to uncouple oxidative phosphorylation. Remember your biochemistry? Uncoupling agents are the things that disrupt the proton gradient along the electron transport chain. In Reye's syndrome, this occurs in hepatic mitochondria. So under the microscope, you can see extensive damage to these organelles. The takeaway point is that you should avoid aspirin in children and even teenagers who have a viral infection or are recovering from one to prevent Reye's syndrome. Lastly, don't forget that the influenza infections are associated with Guillain-Barré syndrome. Do you remember from Campylobacter what Guillain-Barré is about? Right, it's an ascending paralysis, meaning starting in the feet and moving upwards. And do you recall what you would find in the CSF? I bet you're saying high protein with low white blood cell counts, which is also known as albuminocytologic dissociation. You're a superstar. To remind you of GBS, we're going to draw in this stuffed bear sitting here on the boy's lap. And just like our bears from the Campylobacter video, we're going to have the kid grabbing the bear by the leg to emphasize the ascending paralysis. And that's it. That's everything we want you to know about orthomyxovirus and influenza. Remember to review antigenic shift versus antigenic drift, and be familiar with the virulence factors of hemagglutinin and neuraminidase, as well as the drugs we use to prevent them. And finally, don't forget about Reye's syndrome. It's a lot to cover, but it's also a really high-yield virus, so definitely review it once more.